The final problem that we're going to look at is delayed ejaculation, which is the complete opposite of early ejaculation. This is when there is a long delay or absence of ejaculation after normal sexual excitement phase during activity that would be considered pleasurable. Now, it's important to note that most men ejaculate within 4 to 10 minutes of intercourse. This is the normal baseline. There could be a number of causes for the delayed ejaculation. A man could have congenital problems. There could be a duct obstruction. Hypothyroidism could be a problem, or even nerve damage. However, of men who complain of delayed ejaculation during intercourse, it's interesting to note that 75% of these men who have delayed ejaculation can ejaculate when they are alone and masturbating, which leads us to believe that psychological causes are most likely the cause of delayed ejaculation in men. This could include fear of pregnancy, fear of getting caught, could include anxiety, hostility towards their partner, relationship issues. After all, you're probably not going to enjoy the experience if you're not enjoying your partner. Performance anxiety could be a cause. Some men develop more enjoyment from masturbation than they do for intercourse. And there could be a disparity between sexual fantasy and their real partner. I once treated a girl who, and I will say this, she was absolutely gorgeous in every way. She was incredibly beautiful. She was so very smart. She was articulate. She had a great personality. She was in college at the time, but she had these very low feelings of self-worth. She had very low self-esteem. She didn't think she was pretty enough. She didn't think she was good enough. And after some time, we identified that the cause of these feelings was her inability to make her boyfriend ejaculate. He never ejaculated when they had sex. So she thought she wasn't good enough. She thought she wasn't pretty enough. She thought she wasn't able to please her boyfriend sexually. And this really did take a toll on the way she thought about herself and felt about herself. Well, it turns out that he watched a lot of pornography and he was masturbating 5 or more times a day. And this hindered him from being able to ejaculate during intercourse with his girlfriend. So the problem wasn't with her at all, but you can see that although these are men's sexual problems, and it does affect many men's perception of their self and their self-esteem and their self-worth, it can also have a serious effect on their partner. Now, there is no pharmaceutical treatment for delayed ejaculation, but treatment includes things such as masturbatory retraining. It could be recommended that they refrain from masturbating for a period of time. When they do masturbate, it is recommended that they use a lot of lube and they really loosen their grip so they're not gripping too hard when masturbating. There are toys that can be recommended to use to help with this. I would most likely tell the man not to watch any pornography for a time being, and we would work to realign his sexual fantasies. Additionally, some sex therapists recommend role-playing with exaggerated ejaculation, and they would do this first while masturbating and then with their partner.